Hi guys and ladies, I'm Dr. Lim from Sunfert International Fertility Center. Today I would like to talk about AMH. I'm sure you hear a lot about this test called AMH. Now many think that is a test to see whether you can get pregnant or not. Well, not entirely wrong or right. What actually is AMH? AMH is a blood test done to determine our ovarian reserve. Now, why do we need to know about our ovarian reserve and why is ovarian reserve? Now, men and women have a very stark difference in that in women, we are born with a finite number of eggs, which means we don't make them anymore ever since we are born. Unlike men, they continue to make sperms until late into adulthood. Therefore, we do have a finite stores and that goes down with age. Now, just bring you to this chart here. This is probably one of the commonest chart that I bring out to show patients every time during the consultation. Now, as you can see, the green bar, this denotes the normal ovarian reserve, and over the x-axis here is the age of women in years, from 24, 34, 44, right up to beyond 50-year-old. And over here is the value of AMH that is done in picomoles per liter. There are two units used, one is a nanogram per liter and one is a picomole per liter. So as you can see, the women has their best number of eggs before 30-year-old. And after 30-year-old, this number falls gradually. And why is 35 the magic age of so-called advanced maternal age is because after 35-year-old, the rate of drop is more steep, okay? And at about 40-year-old, which is 10 years before menopause, we can see that we already have a much reduced ovarian reserve compared to before 30-year-old. Therefore, this is a test to just find out what is our store like. Now, can that be different? Sometimes a woman at 32 might have lower than normal ovarian reserve, such that when they test their ovarian reserve, they are at about 7 picomole per liter. What does this mean is that they will also follow this graph and probably the window gets narrower and the door might shut faster. So that doesn't mean that they have reduced chance of getting pregnant, but they do want to know that this window is shorter, is narrower, and the door might close faster, and they may want to rethink about postponing their pregnancy and childbearing. Now, how to do this test? It's just a blood test. You don't require fasting. It doesn't matter which day you do in your menstrual cycle. It's something that we would like to find out, especially before or after ovarian surgery, which can reduce your ovarian reserve, and also to see our windows of opportunities. Now, to know more, if you like this video, please click the like and share button and follow us on our Instagram and Facebook. See you there.